Hi class, Dr. Jim here. We made it to Unit 6. Now, Unit 6 is now looking at all the other types of infections that we possibly could get. So we're going to be starting with the fungus today, looking at Chapter 22 and looking at fungal infections. Then in Chapter 23, we'll talk about the eukaryotic parasites, including protozoa, worms, and some ectoparasites. And then Chapter 24 and 25 are going to look at the viruses. So Chapter 24 will look at the DNA viruses. Chapter 25 will look at the RNA viruses. So that kind of gives you an idea of where we're going in the next couple of lectures here and kind of finishing out the semester on a high note, looking at some of these fun infections that we get to deal with. So in today's lecture, we're going to be looking at the fungal infections, and sometimes they're called mycosis or mycoses. And again, these are going to be infections that are due to fungal cells. And typically where we see the two types of infections are either in your lungs or on your skin somewhere. And that's the typical spots that we see where fungus gets in. They rarely get into very deep tissues besides the lungs because of the spores and breathing those things in. And so that's the types of infections we're going to see today. Again, I got some good pictures for you guys to look at and the different types of infections that we're going to be looking at. And really, it all boils down to two different types of fungal infections. There's the true pathogens, which means anyone can get sick from them, and the other type are going to be the opportunistic fungal infections. And so we've probably all have dealt with a fungal infection at one point in time in our lives, somewhere, maybe when we're really young or maybe as we get older. The typical one most people get involves with their skin. It's dermatophyte, probably either ringworm or athlete's foot or maybe a yeast infection, something like that. And those are all different types of fungal infections. So that's what we're going to look at today. Okay. So first we'll talk about what types of fungi cause pathogenesis in humans. And so we'll look at, the different types. And again, the two main types, true pathogens and then the opportunistic. And we'll see how those work. Then we'll look at what types of infections are caused by the fungi and what tissues are most susceptible to infection. And again, I related to either the lungs or the skin are primarily the two sources. And really the skin is probably going to be the most common place that you see a fungal infection. Then we'll ask her what are some of the examples of the true fungal pathogens. So we'll talk about those that can get anyone sick, healthy people or not healthy people sick. And then finally finish up with opportunistic. And this is going to hit people where when their immune system's down or their bodies are changing or they're going through maybe a different infection at the time and then this arises. And so we'll look at some of these as well. And so again, we're going to be talking about a wide variety of different fungal infections, but again, they all transmit through spores, through the air, and then we breathe those in or get in contact with them, skin to skin contact, and that's how we get them. Okay, so let's look at some fungal infections today. All right, so again, molds and yeast are widely distributed in air, dust, fomites, and normal flora, and they're found everywhere. Okay, humans are relatively resistant. We don't have a lot of fungal infections, but there are places on our body that really are susceptible because they're warm and moist areas, and that's where fungus likes to grow. And generally, if you have very good hygiene, if you maintain your hygiene and if you're showering every day and that stuff, you primarily do not have a problem with this. However, there are some places no matter how well you clean, you still can get a fungal infection. So it's not all hygiene, but a lot of it has to do with hygiene in that. Again, fungi are relatively non-pathogenic in that over 100,000 species of fungi, but only about 300 of those actually cause disease. And so again, very small number, but those small numbers can be very aggravating, pretty nasty looking diseases when they do get caused. Now, fungi do cause a lot of common plant pathogens or a lot of plant pathogens. And so if we were plants, we'd probably be worried more about funguses. But as humans and animals, we don't seem to have as many of the fungal infections out there as plants do. And again, human mycoses, which again or mycoses are again fungal infections that are caused either by true or opportunistic pathogens. And so again, we'll take a look at those and some of the different types that are out there today. All right, here's a list of the fungal pathogens that, again, most people will come across in their lifetime. These ones up on top are the true pathogens, and typically these are breathed in or through the respiratory system, and so this is primarily where you get them. And again, it's disruption of soil or other areas where you have lots of dust and debris, kind of breathing that in, and then these things can vegetate in your lungs. These, again, the intermediate virulences include a lot of the dermatophytes, which includes lots of things like ringworm, athlete's foot, jock itch, a number of different types of skin infections. Sometimes you can get fungal infections of the scalp and all these other things. And so, thinking about skin in these things or cutaneous infections, that's where you're going to see those. And then finally, we're going to be talking about some of the opportunistic ones. And again, these include things like yeast. And so when we talk about thrush, which grows in the back of the throat, or someone that gets a yeast infection in the vagina, that can happen. Aspergillus is another one that typically you don't see out in the body, but if you're immune compromised, you may get this infection in the lungs. Cryptococcus is another one we see very highly associated with AIDS patients. And then pneumocystis is another one that we see a lot now with AIDS patients, especially when the immune system is weakened. So people on transplants, people that are on cancer therapy drugs, and then people that have weakened immune systems due to disease as well. And so those are the ones that we worry about the most when we're talking about opportunistic. And so you may hear about these things a lot of times when you're taking drugs, especially if you have autoimmunity, a lot of times like Humira and some of these other drugs that are out there, because what they do is they weaken or lower the response to the immune system, but now it sets up an opportunity for these fungal infections to occur. And so that's why one of the warnings they say on there is that you may be at greater risk to fungal infections. Because typically, if you have a healthy immune system, fungus doesn't bother you very much. However, when that immune system is weakened, you are setting yourself up for lots and lots of different things, especially because these guys can pass through as spores in the air. And so that's where we see most of these infections. Okay, so again, we'll talk about the fungal pathogens. And again, the true or primary fungal pathogen can invade and grow in healthy, non-compromised hosts. And so we've talked about this before in chapter 13. The difference between a true pathogen and an opportunistic one is a true pathogen can get healthy people sick. And so we'll talk about some of these fungal infections that doesn't matter if you're as strong as an ox or very weak in immunity, you can get sick either way. Whereas the opportunistic ones only infect those that have an opportunity for the immune system to be weakened. So they're fighting other types of infections. They themselves are immune deprived, or something is weakening their immune system, and we'll look at that. And again, the most striking adaptation to survival and growth in human hosts is the ability to switch from the hyphal cells to yeast cells, and I'll show you what that is in a minute. And the thing you want to remember is that when you see fungus typically growing on your food and and mold and that stuff, it's typically kind of hairy. That is the hyphal cells. Okay, so when you think of hairy or furry, think of hyphae. When you think of yeast, kind of think more of a bacterial like culture where it's kind of slimy and can grow on plates and looks more slimy or smooth like, and so no fur associated with that. And what happens in humans is that we get exposed to the hyphae form, and then when they get inside of us, they switch over to what is looking more like the yeast form, so it looks more bacterial like. And so that's one of the reasons that it can grow so well in humans once it gets into us. And again, there's a thermal dimorphism, which grows molds at 30 and yeast at 37. So again, it's all about where they are. If they're out in the room temperature, they grow as more like molds. And when they're in us, they grow more like yeast at 37 degrees. And so that's the idea. They can switch back and forth based on the temperature that they're growing at. Okay, and here shows you a little bit. So again, when I say hyphal colonies, that means furry. So think of furry or hairy. And then when they get inside us, they look more like bacteria. So they kind of look more slimy, more rounded, again, kind of more like the bacteria, smooth, all those different descriptions that we use for bacteria when we're looking at them on plates can be applied to fungus when they're grown as a yeast type of cell. And again, these guys can go back and forth depending on where they are at. And a lot of it has to do with the temperature that they're grown at. So under 30 degrees C, which would be room temperature and less, maybe a little bit higher than about 80 degrees Fahrenheit and less, they're going to grow as furry things, okay, as furry, fluffy things. Whereas once they get inside us, about 35 to 40 degrees C inside us, they're going to be more like the bacterial stages. So just remember that when people get these infections, it's going to look more like the yeasty things than like the furry things that grow on your cheese or your fruit or any of those other things that you might see in your refrigerator. Okay, so that's what we're looking at today. All right, and again, emerging fungal pathogens, these are some of the newer ones. And again, the difference between the true and the opportunistic: true can affect anyone, opportunistic only infects those that have an opportunity to be infected. And again, degree of virulence: true pathogens are going to be well developed because they can affect both healthy and non-healthy, where opportunistic are going to be limited to those that have a weakened immune system. Condition of the host, again, resistance high or low. Only in the opportunistic, resistance is going to be low. Typically, true pathogens enter in through the lungs, so we breathe in the spores, whereas in the opportunistic are going to be respiratory or mucosal layers, and that nature infection, primarily pulmonary and respiratory systems, and often asymptomatic, whereas the infection here can be superficial skin, pulmonary, can be septicemic depending on the type of infection. Again, the nature of immunity, well developed and specific. This is going to have a weakened because, again, the immune system is down. Infecting form is going to be condidal, or again, typically the yeast form, versus some of these can be the furry pathogen and get in again to the opportunistic. And again, thermal dimorphism is highly characteristic. These will either stay as yeast or as the furry type of growth, and again, opportunistic, and we'll look at this as well. Typically, these guys are found in the soil, and this can be from soil, other humans, and other animals because, again, they can spread opportunistically. And again, where we see these things are typically endemic regions. And if you're going into areas where these can be found, they might put a warning out saying, just be careful because whatever you breathe in, or you might want to wear ventilation or other things like this, because these are highly susceptible in healthy people. And then the opportunistic are pretty much worldwide. However, again, healthy people are not really at risk because we don't worry about some of these things so much. Okay, so kind of looking back over, opportunistic pathogen has little or no virulence. Host defenses have to be impaired. Again, they vary from superficial and colonization to potentially fatal systemic disease, depending on where they infect. And again, an emerging medical concern account for about 10% of all nosocomial infections. And again, what happens in a hospital? These people are immune compromised. They're sick with something, and now you're giving them something else on top of it. So that makes it very hard. And dermatophytes may be undergoing transformation into true pathogens. So the ones that we say that are on our skin, and a lot of times like ringworm and other things, are getting more and more resistant and becoming more like a true pathogen and can affect healthy and non-healthy people at the same time. And we'll look at that today. All right, so the epidemiology of the mycoses, and again, the most fungal pathogens do not require a host to complete their life cycles, and the infections are non-communicable. So typically, we don't worry if someone has it, unless you have open wounds or other things, or you're really breathing in the same air. We don't really think of these as contagious or spreading from one person to another. Now, dermatophytes and Candida naturally inhabit the human body and typically don't bother us unless our immune systems are weakened, and they can be transferable from one person to the other, especially if you have skin to skin contact. So ringworm outbreaks are very common when you see athletes rubbing their skin together, when you have things like football or wrestling, or where you have a lot of skin to skin contact in sports. Ringworm is very easy to transmit throughout the whole team or other teams and get breakouts like that. Candida is yeast infections, and again, that can be spread sexually. So if one person has the yeast infection, and then they can spread it to their partner, and that partner, if they have other sex with other partners or whatever, they can spread those types of things. And again, typically the most common types of infections that we see is involving the skin and areas around the skin. And again, sometimes they go undiagnosed, other times they go or misdiagnosed because you think you have some other type of skin ailment, and it turns out to be actually a fungal infection. Sometimes it might be looking like bacteria or a virus or something else, and it may be undiagnosed or misdiagnosed based on the type of infection you actually do have. Okay, again, the epidemiology, these are where the true fungal pathogens are distributed. And again, looking at Wisconsin, really the only one that we are concerned with here is Blastomyces. But again, people do go throughout the United States, and we'll see that the coccidioids are found in the western U.S. Histoplasma is found not only out east, but in the mid-central states and even in the southwest. And then the Paracoticides is found in Central and South America. So again, not too many people here necessarily be exposed to it unless you're going to go on a vacation to one of these places and visit. Some of you guys that are watching this on YouTube might be from those areas, and so you might see these infections down there. But primarily, if you look, most of the fungal infections that we worry about are located in the Western Hemisphere. And again, looking at really North and South America in those cases. And again, there's probably other things in the East and that, but being from the United States, that stuff we're mostly concerned about what's going to affect our health and that around here. But there are some other ones out there, but these are primarily the ones that we're going to be talking about today as true pathogens. Okay, now again, some of the opportunistic ones include Candida, which again, we see that's the yeast infections in that, and again, can affect antibiotic therapy, catheters, diabetes, sometimes steroids, and immunosuppression. Aspergillus is another kind of fungus, and again, is associated with some of these. And again, corticosteroids weaken the immune system, and that's why. Cryptococcus, another one we see with diabetes, tuberculosis, cancer, immunosuppression, so HIV, and the zygomycota, which is actually bread mold. Bread mold can actually cause, again, infections in opportunistic. And so this can be pretty scary if we're talking about people that, if they're not healthy and they've got moldy bread in the refrigerator, could actually get the disease potentially from that moldy bread if they don't take care of it because their immune systems are weakened. And so you have to be very, very careful with some of these things because they can spread, and it spreads easy through the air as spores. Okay. All right. So again, the portal of entry. So for the primary mycosis, it's the respiratory portal by breathing in the spores. And again, spores are found throughout the air, and some of you guys may even have allergies, and we'll talk about that at the very end today about the allergies associated with fungus. Subcutaneous, again, the inoculated skin. Trauma sometimes. So if you have tears or puncture wounds or other things that can get it in the skin. And then we're going to talk about the difference between cutaneous and superficial. Cutaneous is getting into the cutaneal layers of skin. So we're talking about not only the epidermis, but also the dermal layer under the epidermis. Superficial would be right on the skin surface. And so that, again, is where you see some of these infections as well. They don't penetrate, but they're on the skin surface, and they're tough to get rid of because they like to grow on these different spots. Again, some virulence factors associated with fungus is thermal dimorphism, that ability to switch from the furry strain to the yeast strain. Toxin-like substances, so we'll talk a little bit about this, especially when we get into the later sections. Capsules and adhesion factors, hydrolytic enzymes to break down connective tissue. That's how they grow and get in. And again, they do their digestion on the outside, so they release secretory enzymes to digest, and then they reabsorb it through their cell membranes. And so that's how they eat. So they don't eat physically like a Pac-Man or how you or I would eat. They eat by releasing enzymes, digesting, and then reabsorbing that digestion. Okay, and inflammatory stimulants obviously is another one where we see infections and other things that cause inflammation can lead to also fungal infections. Okay. All right, so host antifungal defenses. Again, antifungal defenses are the integrity of the barriers in the respiratory cilia. So again, where do we see infection? The skin and the respiratory tract. If you have good ciliary elevator and movement of your cilia throughout the respiratory system, you really shouldn't have a problem containing a lot or getting a lot of these infections. Now, that's not always true with the true pathogens, but again, how well those work and how well they get rid of the pathogens out of your respiratory system can play a big role. So if you're smoking or other things, have problems with asthma and breathing, that can lead to more fungal infections than someone that's very healthy. Skin, on the other hand, again, a lot of times the intact skin is going to keep you together. But anytime you have cuts, abrasions, rips, tears, punctures, that leads for the opportunity for these things to get in. And again, Most important cell defenses are cell-mediated immunity, phagocytosis, inflammation once they do get in, and long-term immunity can only develop for some. Not all of these pathogens, there are some that can, but typically because they don't get in very deep, that's why we don't see them. We don't typically see them in the bloodstream. We don't see a lot of these other things unless they're put in there by some method, and we'll talk a little bit about that as we go on as well. Okay, so the first concept checked, which phase of the fungal life cycle is best adapted for growing in the host body? Is that the yeast, the hyphal, the candida, or the filamentous? Which one is the best adapted? Which one have we been talking about the most? And again, that's that thermal dimorphism. Okay, if you said yeast, you would be correct. Remember, the yeast are the bacteria, the smooth colony looking like ones that grow on the plates. If you said yeast, you got it correct. The hyphal are the furry, Candidia are more spores, and filamentous, again, is more of the hairy or furry kind of appearance due to these fungus. Okay, and so that's what we're looking at today. So think of yeast when you think of infection. Okay, so how do we diagnose mycotic infections? Well, again, identification required through microscopy, viewing stained specimens and looking in selective and enriched media. And you guys now have experienced that in my lab, the selective and enriched, and you know how some of these media can select for different types. Same thing is true with fungal. We can have certain media that will allow us to grow fungal species rather than bacteria. And again, specific biological and serological testing can be done to test to see if you have these different types of infections. Okay, and so again, think of the furriness. That's what we're thinking of. And then once it gets in, the germinating yeast and growing on the body. That's what happens inside of us. Okay, this shows you again methods of processing specimens, and again a lot of these are taken. So the first one would be sputum. You can grow it on a plate and then look for selective agar, demonstrate dimorphism. Sometimes you can do inoculations and do antigen tests, inoculate animals and that stuff to see. If you're talking about blood, cerebrospinal fluid, pus, vaginal secretions, again, looking in and plating on selective media, looking at morphology once it's growing on a plate. And you can, again, do a number of different tests to look at these different types of things to see how they're growing. Again, hair, skin, and nails, a lot of times it removal of those tissues and then looking at it under the microscope, sometimes to incubate it on selective media, and again, macroscopically looking to see what grows, and again, air test or look at it microscopically and see. But again, a lot of different types of ways to look in that stuff. And then finally, the tissue biopsies and punches where they actually take small pieces of skin. You can either do a section and do histological stains to look for it under the microscope, or you can grind and inoculate animals. You can do dimorphism. You can also do staining on plates and that, and again, selective, differential, biochemical, even DNA tests to see what type of specimen are we talking about. So a lot of these things require grabbing a sample off a patient and then testing in the lab. So it's not a really fast response and saying, oh, you got a fungal infection, let's just give you this. How are you going to find out? A lot of times when we treat fungal infections, it's going to be the same medicines and pretty much all these different things. And that's because there's not a lot of drugs, because remember, fungus is eukaryotes, so the targets are limited. We're limited to their cell walls and sometimes their cell membranes, and that's where you're going to see most of the drugs or antimicrobials against the fungal species here. Okay, and so again, it might be one of those things. And so it's not uncommon to hear where people, if they have nail infections or skin infections, that they actually remove part of the nail or part of the skin to actually have to cultivate it and grow it in the lab. That's not uncommon or not unheard of at all in those cases. All right, so that's what we're going to be looking at. All right, so control of mycotic infections, again, typically immunization is not very effective, and again, that's because of we really only worry if you're healthy is the true pathogens. The other ones are more opportunistic in that, and there's not a lot of vaccines out there to begin with. And again, typically what we look at is these typical drugs, and this is the control once people get it. The amphotericin B, flu, cytosine, azoles, and nystatin. So the two typical drugs that you see in any fungal drug is the amphotericin B and nystatin. Some do require the removal of damaged tissues, and again, it's not uncommon to have not only tissue removed, but samples removed for not only for growing, but also just to remove it, just to get rid of the fungal infection. Sometimes that's easier than trying to treat. And again, prevention is limited to mask and protective clothing, especially when you come in contact with spores. So if you go into an area that's endemic with these things, where you know that you can catch these things and you're going to be disturbing the ground and breathing in these spores, it's always very healthy to wear a mask when you're doing this, a ventilation mask. And again, something that's not just a little paper mask, but something that's going to be very helpful and filter the air for these spores. That's going to be key whenever we look at that. On the right over here is a list of the different types of drugs that are out there. And like I said, very few drugs because they're more like us, so there's not a lot of targets. The biggest thing are the cell walls and the plasma membranes when we think of with the fungus. Okay? All right. So again, how do we look at these diseases? There's the two ways. You either look at it as the true pathogens, and again, this can be systemic, meaning throughout the body, cutaneous, and superficial. Systemic comes in through the pulmonary, breathing it in. Then we'll talk about the cutaneous and superficial. Those are going to be on the skin. And the opportunistic are going to be typically on the skin, but some of them are inhalation as well. But the opportunistic, remember, you have to have a problem with your immune system in order to get these things. All right, so here's a list of some of the, again, fungal pathogens we're going to look at. So the three main systemic ones, which you can breathe in, and this can cause systemic disease, include Histoplasma, Coccidioides, or Coccidioides, and then Blastomyces. And then the cutaneous include the Sporothrix, the Chromoblastomycosis, and the Dermatophytosis. So these are a lot of our skin infections, the ringworm and other things like that. And then again, the superficial, I'm going to show you one disease, this tinea versicolor, and that's another one that can cause superficial disease, and it kind of causes a disfiguring of the skin, decoloration, and again, it's only on the top layers of skin. Now, when we look and see how mycoses begin, typically most of them are going to be superficial, meaning in the upper layer of the skin. Some do get cutaneous, and again, that can be the epidermis and then get into the layers of the dermis, the upper layers of the dermis. And some can be subcutaneous, which means gets all the way from the upper layers way down into the subcutaneous tissue. So depending on the species, how deep they go, sometimes getting into the hair follicle or some of these sebaceous glands or even getting into the blood system will bring them down further. And so anytime you have a tearing, ripping, abrasions of the skin, puncture, this is always going to allow for more of the fungus to actually get in. Okay, and so this is how they do get in. Typically, if your mechanical barriers are good, you shouldn't have a problem with these things. Okay, so systemic infections by true pathogens, again, are restricted to the endemic regions of the world. We'll talk a little bit about the ones in the United States. Some of these other ones, if you're from other countries in that, you might want to look those up and just take a look to see where they're located in that. Again, there are a couple that are found in Central and South America. There's some in Africa as well, but today I'm going to stick primarily with the ones that are associated with the United States. Infection occurs by matter containing the media that is disturbed, and so that can cause an issue where you get this media that's disturbed, you breathe it in, and that's where you're going to get it. Again, spores are going to be coming in, and those are going to be causing the infection. So you breathe in the spores, they get into your lungs, and that can cause infection. Again, the infection can get systemic because they're now inside you, so it can get into the blood. And spores may even be inoculated on the skin, especially if you have abrasions, cuts on the skin, and that you're not wearing protective clothing. And again, all these diseases here will result in immunity because you do get it into the bloodstream, you do get it exposed to white blood cells, so you do see B and T cell immunity in these cases. Okay? All right, so the first one we're going to look at is histoplasmosis, or also known as the Ohio Valley fever. And so this was first documented, obviously, in the Ohio Valley and areas around that. And again, where we see this is the eastern and central regions of the United States, but it is distributed worldwide. Typically, it's dimorphic, meaning it goes from a furry to a yeast stage once it gets in. It's the most common true pathogen, and it causes a disease called histoplasmosis. Okay. Grows in moist soil high in nitrogen content. So if you like to fertilize your soil a lot, have lots of nitrogen, you may have more of these spores in your soil. Inhaled Candida produce primary pulmonary infection that may progress to a systemic involvement in a variety of organs and chronic lung disease. And again, the two drugs of choice, amphotericin B and ketoconazole, okay, and ketoconazole. And again, that's another type of drug that can be used. But typically, the amphotericin B for the systemic, and again, typically starts as a lung infection that goes systemic. Now, what happens is, again, soil containing bird droppings is whipped up by the wind. You have these wonderful little spores that you inhale. You get it into your lungs, and it can then grow into your lungs. It gets into the phagocytes. The yeast continue to grow, develops into pneumonis, which might reoccur. And again, the tissue phase of the infection, the yeast in the phase develops. It's phagocytosed and multiplies in budding intracellularly. Most patients recover without complications. It then, once it's into these phagocytes, it can spread throughout the rest of the body, and you can see that it can disseminate into a number of different organs. And again, always, anytime you get into the CNS, that's critical. But obviously, heart damage can relate, liver damage can get intestinal problems, kidney problems, and even into the bone itself. But typically, most of these stay resolved in the lungs. Eventually, your body will fight it off and you'll get it. But you can get this pneumonis, which is basically an inflammation of the lungs. You might have trouble breathing, kind of like a bronchitis almost in these cases. And it might be due to a fungal infection, this histoplasmosis. Okay, now another one is the Coccidioidomycosis, which is known as valley fever. And again, it's this Coccidioidomycosis, and again, it causes this Coccidioidomycosis, big and lovely word here. It has distinctive morphology, block-like arthrocondidia in the free-living stage, and spiracles containing endospores in the lungs. Likes to live in alkaline soils of semi-arid hot climates and is endemic to southwestern United States. And so we see this mostly in places like Arizona, California, New Mexico, and Texas. That's where you're going to see most of these things. And again, the warm, hot soils, so if you're going to do any digging, you're more likely to want to wear respiration and that stuff because these things can be brought up. Again, it's hailed through the dust, creates these spiracles, and can form nodules in the lung. And again, amphotericin B is the treatment. So again, you're going to see that over and over again. Amphotericin B is primarily the treatment for a lot of these different types of drugs. Now again, what happens, digging in the soil produces aerosol of the arthrospores. Not wearing ventilation and that stuff can trigger this. The arthrospores get into the lungs. They establish a lung infection. Again, these arthrospores grow and germinate into these endospores. In compromised people, they can develop meningitis, osteomyelitis, and skin granulomas, so you can get a lot of different types of infections. Typically, the immunocompetent persons effectively fight the infection and return to health. So again, sometimes flu-like symptoms, bronchitis, other things associated with lung infections, and then eventually it goes away. It clears itself, and then you survive and you move on. If you're immune compromised, obviously everything is multiplied 1,000 times worse, and so you have more problems with this and can lead to more systemic type of infections. Okay. All right, and this just shows you some of the skin infections that are associated. So again, these are the superficial. This is the fungus actually growing under the skin. You can see here's nodules in the skin, and this is, again, breathing in. So I would assume both of these people are immunocompromised, where they have more of these skin-like granulomas and skin infections due to these spores that are now throughout the body and going into the skin and causing these eruptions to occur. Okay, one way we can test is called the immunodiffusion test, and what you're looking for, again, is the antibodies in the blood. And so what you do is you have a control serum, you have the patient sera, that is the blood, you have the antigen inside, and then you see some of these other ones, and what you're looking for is these lines of precipitation. That means that there's antigens and antibodies that are binding together. If the sera is clear, like in this number 3 or number 6, that means you don't have antibodies to it. That means you don't have the infection. So this is one way we can test to see if a person is infected with this, by looking at the antibody production in their body. Okay. Another one is the Blastomyces dermatitis, and again, this is the North American Blastomycosis. This is one that's found, again, in the Midwest. and typically causes the blastomycosis, and it's dimorphic again, furry, then yeasty. Then again, free-living species distributed in soil in large section of the Midwest and southeastern United States, and again, found in the soil, typically in the air, can cause lung infections as well. You breathe these in. Again, inhaled anywhere from 10 to 100 candida, which are the spores, convert to yeast and multiply in the lungs. Again, symptoms include cough and fever, can become chronic cutaneous bone and nervous system complications. And so here is a really bad situation where it's actually growing subcutaneously under the skin and causing these infections. You can see the whole skin is inflamed and infected, and you can actually see the mold part of it growing on top of the superficial. Again, the treatment is amphotericin B, so this would be a very severe case, and you can see very nasty, and obviously hospitalization is required at this point. Typically, most people get over it. Again, the cough and fever, you fight it off, your body fights this off, and then you live for another day and no problems. But again, sometimes it can get into chronic situations, complications where it involves the skin, bone, and nervous system. All right. So the primary reservoir for Candidiasis and Immunodiffusion is what? Infected humans, chronic carriers, wild animals, or soil. Where are most of these spores found in the environment? You said soil, you are correct. So it is the soil in this situation. So again, messing with the soil, digging it up, releases the spores in the air. You breathe in those spores, and then you get sick. And that's the true pathogen way. Breathe it in and can cause lung infections. And again, not the most common thing in the world, but you just have to be in the right place at the right time, breathe enough of these spores in, and then get sick with these things. And again, healthy people are as much of risk as non-healthy or immune compromised folks that are out there. All right, so now let's take a look at some subcutaneous mycosis. And again, this is transferred directly to traumatized skin, and they can invade. So typically we associate these with puncture wounds, infections with abrasions, cuts, deep wounds, and that stuff. Again, brought in through by spores. Most of the species in this group are greatly inhibited by higher temperatures of the blood and viscera, so they maintain in the skin and don't get very far. And again, diseases are progressive, meaning that they start to spread throughout layers of skin, but they don't go in and get systemic throughout the body and infect tissues inside the body because the temperature of our body tends to inhibit some of these growths. Okay, one of the most common types is the Sporothrix. This is known as the rose gardener's disease. And again, you can see here are the spores. The spores enter in through, again, through damaged tissue. It's a very common saprobe of decomposing plant matter in soil. So this is called the rose gardener's disease. So you guys that like to dig in the soil, if you have cuts and abrasions, these things can get into your hands and arms and legs and that stuff and lead to wonderful infections, these subcutaneous infections, which are hitting both the epidermis and dermal layers. So these are pretty nasty infections. Again, infects the appendages in the lungs, can get into the lungs too. And the lymphocutaneous variety occurs when contaminated plant matter penetrates the skin and the pathogen forms a nodule, then spreads to nearby lymph nodes. So again, maintains in the skin and then can spread and go throughout the body once it gets into the lymph nodes and that. And so you remember, the lymph system is a nice little highway for things to get around in those cases, and it's no different with the Sporothrix. Okay, a couple other ones are the chromoblastomycosis, which is a progressive subcutaneous mycosis characterized by highly visible verrucous lesions. So verrucous means like pimple or cauliflower-like. So if you start to see these bumps and really ugly looking nodules growing out of the skin, it may be due to this chromoblastomycosis. And again, it's an etiological agents in soil with dark pigmented mycelium saprodes. Here are some of the species. It produces these very large, thick yeast-like bodies, sclerotic cells, and again, disruptions, and it causes these very large nodules growing on the skin and other parts of the body. Another one is this phaeohyphomycosis, which is the causative species in appearance of the infectious agent. And again, it's another one that gets into the skin and subcutaneous layers, causing infection in these cases. Okay. Another one is this mycetoma, which again, soil microbes are accidentally implanted into the skin, and it's a progressive tumor-like disease of the hand and foot due to chronic fungal infection may lead to loss of the body part. Here's a severe case where, again, when you're walking barefoot through soil and you have cuts and injury in the skin, these things can get in and they start to look like they produce these nodules or cancer-like growths, and again can lead to abnormal growth of the tissue around and eventually could lead to the loss of the foot or hand or arm due to the infection that you have in here. It's caused by these two different groups, the pseudo Elascara and the medullera are the two different types that cause this. And you can see here's what's going on in the skin. You can see the destruction of the skin under here and the growths that are growing upon there with the fungal infections that are going on. Okay. Now the cutaneous mycoses, these are probably the most common type that we're associated with. So a lot of these other ones you may hear of where people are working outdoors and that, these are typically the ones that we see a lot of, okay? And so when you're thinking of dermatophytosis, these are going to be the skin infections that we get typically. So this is your athlete's foot, your jock itch, some of these other fungals that grow on the skin. Again, there are about 39 species, and again, the trichophyton, the microsporium, and the epidermophyton are the three common types. And again, we'll look at this. It's a causative agent of ringworm, and it varies from case to case. And again, we're going to see some of these different species and where they can infect, and a lot of these get different names based on where they infect on the body. Okay, and ringworm is that one that kind of looks like the basically where the skin, where the infection gets under the subcutaneous layer, and it causes this rising or inflammation that's almost in the shape of a ring, and it looks like a worm. Looks like a worm is under the skin. It is not a worm, but actually a fungal infection growing under the skin that can be passed anytime you come in contact with it. Okay, so the natural reservoirs are humans, animals, and soil. The hardiness of the dermatophyte spores, presence in abraded skin, and intimate contact promote infection. So again, skin-to-skin contact. These can be passed, again, people that have athlete's foot and then use public showers can spread the athlete's foot to other people. So if they have ripped up, open up skin, and you have sores on your feet or on your skin, you can get these infections as well. And this is, again, the idea of the burning, the cracking in between the toes, around the nails, the nail fungus, the yellowing nails and that stuff. That's the fungus growing underneath the nails and that stuff. And then you can also get the ringworm, which is more commonly seen around the neck, the shoulders, the head, and those areas as well. Okay. Again, long infection period followed by a localized inflammation, allergic reactions to the fungal proteins. And again, there's lots of topical creams out there, sprays and that stuff that can do a pretty good job. And again, you can go to the doctor for diagnosis, but most of the time, most people understand what it is and they go, get some over-the-counter treatment, clear it up, and it goes away. Okay, with a little bit of time and perseverance, I guess, in those cases, because you just have to keep it up. Okay, the three most common types are the trichophyton, again, ringworm of the scalp, body, beard, and nails. This is the primary cause of athlete's foot. Where do you find these? The hair, skin, and nails. Typically human to human, sometimes animal to human contact. The microsporum is ringworm of the scalp and the skin. Again, scalp and hair, skin, not the nails, animal to human, soil to human, human to human contact. And the epidermophyton, again, is ringworm of the groin and nails. This is the jock itch and some of those other ones that gets a wonderful name. Skin, nails, not hair, and it's strictly human to human. So again, spreading to human. Again, a lot of these things too relate to how cleanliness or hygiene you have. And so the better hygiene you have, the better off you are. So again, thinking about athlete's foot and things like this. Changing your socks readily, keeping the moisture content low down on your feet. You're growing, those things grow because they're warm, dark places. And so you will definitely have those problems if you don't take care of your hygiene. You're going to get more and more growth of these things growing if you don't clean up after yourself. Okay, so a couple of these wonderful, interesting pictures here. The first one is the ringworm of the scalp, known as Tinea captis, and again, affects the scalp. Head-bearing regions of the head and hair may be lost, so this is a pretty nasty ringworm infection. Again, kind of this uprising where it's growing is underneath the epidermal layer, between the dermis and epidermal layer. You see this rising, and that is typically associated with this ringworm. The second one is the ringworm of the beard, typically Tinea barbae, and again affects the chin. beard of adult males, contracted mainly from animals. And so a lot of times, especially guys that shave and that stuff, can get these different types of infections due to the spores getting into the infection, into the hair follicle. And you can see this happen a lot of times. But typically, we see this especially in people that work with a lot of animals or have a lot of animals that also have infections as well. And so you may see this. Another one is a ringworm of the body. This is by Tinea corporis. And again, occurs in inflamed red ring lesions anywhere on smooth skin. So this is probably the most common type that people hear of when they think of ringworm. That's the one that's kind of gives the round appearance. Again, the inflammation kind of looks like a red ring. And again, people think that they're actually worms under there. It's not a worm. It's a fungal infection underneath the skin. And so that's what that is, okay? And so that's the most common type. Okay, some other ones, the ringworm of the groin, the Tinea curris, which is the jockish, affects the groin and scrotal regions. And again, warm, moist places. Don't have to tell you too much about that. Ringworm of the foot is Tinea pedis and Tinea manum. And again, it's spread to exposure to public surfaces. So again, if you use places like the Y or, workout clubs and spas and that stuff, you always really want to protect your feet, especially in showers and that stuff, because if people have this and you have open wounds on your feet, it's very common to get that from a public area. So these things live on surfaces. You got moist, warm surfaces that these things can grow, especially in showers and other areas. These things can spread very easily. Now, this is a horrible case of athlete's foot, but typically most people will see athlete's foot in between their toes. You might experience some cracking and bleeding and sloughing of skin, but typically that's where it's there. Now, this is a really bad case, and obviously someone that hasn't taken care of themselves in a while, but that's what you can kind of see. Now, ringworm of the nails, this is the Tinea urganum. And again, this is a persistent colonization under the nails. This is the one that they always show those commercials like toenail fungus and those things. That's the disease. And sometimes you have to take an oral medication because the topical just doesn't get deep enough under the nail. The keratin of the nail kind of blocks that from getting treatment. And so a lot of times you have to take the oral medicine to get underneath that skin. This sometimes is where, if you do have persistent nail infections, where the doctor may choose to remove the nail so that it can grow back healthy and treat it that way and remove part of the nail so that you can treat it and do that. So that's part of the treatment option. So it doesn't sound too pleasant and that stuff, and it may not be too pleasant, but at least it might cure the infection. But again, there's lots of over-the-counter medications and that stuff that you can take that really work very well on these situations. Now, get something like that, then you might need more than just a topical cream to take care of that. Okay, so treatment of the dermatophytes includes topical antifungal agents, like I said. Tolofenate, micronazole are applied for several weeks. Again, Lamisil, so you may have seen the Lamisil cream for athlete's foot, or the spray and that stuff. Grisfolvin is another one for 1 to 2 years, and this is the oral medication. So this is the one for nails, especially because it's very difficult to get under the nails with the topical. So a lot of times what you'll do is actually take a pill for a while, and that will treat it from the inside out, and so you get it that way. And again, during that treatment, it's not uncommon for nails to fall off and do those things because the nails are damaged, the nail bed is damaged, and so it needs to repair itself. So it's not uncommon for the nails to fall off. So your doctor should tell you that as well. So it's not that your hand is falling off or anything else, but that's part of the healing process sometimes as well. And a lot of times you can tell if you have infections, if you have yellowing of the nails, cracking of the nails, or sometimes even sloughing or breaking of the nails, or irregular growth of the nails tell you a lot as well. And so those are all the different types of dermatophytes. Okay, now here are the superficial. These grow on the very top part of the skin, but you can see can lead to discoloration and problems of the skin. And again, this tinea versicolor is caused by this Melzia furfur, which elicits a mild chronic scaling, molting of the skin. Also implicated in folliculitis, psoriasis, and seborrheic dermatitis. And again, you can see this. It's typically a skin infection on the top levels of skin, causing a sloughing of the skin to come off. And especially, obviously, if you have any pigment to your skin, pigment color, this is what you see. And you may see some people actually have this on their face and other parts of their body. and again, it's not uncommon for this, and this is due to a fungal infection. Now, another one is this white pedra, which is caused by this Trichosporin bijeli, which is a whitish or colored masses develop on the scalp, pubic or axillary hair, and so you might see these white masses growing in different spots that cause a discoloration of the hair. And then the black pedra is caused by the Pedrata horte, which is a dark brown on the black gritty nodules, mainly on the scalp and hairs. And here you can see a hair where it's actually growing on the hair itself. And so you see it actually growing on the hair and causing this nodule to form, and it gives you these dark spots on the hair as well. So these nodules on there. And it's not due to excess shampoo or something like that. These are actually fungus infection growing on the hair itself. Okay, so again, dermatic fungi attack the blank and in the blank. So what do they attack? And so do they attack the epithelial cells in the lungs, the melanin in the stratum corneum, the keratin, skin, nails, and hair, or the bone and foot? So which ones do the dermatophyte fungi attack? Okay, if you said the keratin, skin, nails, and hair, you would be correct. So what have we been talking about the last 10 minutes? All about the skin, hair, and nails and all these different things. And so that makes a lot of sense. The protein that's there that the fungus is attracted to is obviously the keratin. Keratin's in your skin, and primarily a lot of keratin in your nails. And that's what gives it its rough or tough ability to protect, okay, is that keratin. All right, now we'll talk a little bit about the opportunistic mycoses, and then when we go through these, again, typically what we see in these situations are people have other infections going on, they have weakened immune systems, and that's where you see these diseases. If you have normal, healthy immune systems, you should not be affected by these things one bit. But again, if you are sick with something, you have changes in your body, or you're immune compromised, these things can cause serious problems with you, okay? Again, the biggest one is Candida. That is the yeast infection. We'll talk a little bit about that. Aspergillus, Cryptococcus, and some of these other ones are spores that you breathe in. And again, they can cause systemic infections, especially if you're opportunistic. All right, so Candidian albicans, this is the widespread yeast. Again, infections can be short-lived, typically are either superficial skin irritations to overwhelming fatal systemic diseases, depending on the immune system and again how well someone's immune system's doing. The budding cells of varying size that may form both elongate pseudohyphae and true hyphae, and forms an off-white pasty colony with a yeasty odor. And so again, some of you may have experienced yeast infections before, either in the throat or in the vagina, and know exactly what I'm talking about. And so you may have smelled the yeasty thing and yeasty smell and that, and know exactly what I'm talking about here. So I won't go into too much other detail. But typically you see this white flakiness associated with this. I'm going to show you a picture here of thrush, and you're going to see, and you're going to be like, yeah, I can see where that comes from. And that's a yeast infection. So again, Candida albicans is a normal flora of the oral cavity, genitalia, large intestine, and skin, about 20% of humans. Now at normal, healthy humans, that is at a very low rate. And again, the carriage rate means that they're not infected by it. It means that they have it, but it doesn't really affect them. Again, this does account for about 70% of nosocomial fungal infections. And again, it's associated with people, especially if they're not swallowing properly. So those that are maybe not eating very much and may have issues with their swallowing. And so you see thrush develop a lot of times that way. Or again, UTIs and other yeast-like infections associated with, again, catheters and other situations. And so these are going to be the ones that we typically see with the yeast infection. So the first one is thrush. This occurs as a thick white adherent growth on the mucous membranes of the mouth and throat. And again, this is a pretty serious case, and you can see even some of it is on the lips here and that. And again, this is typically in people that are having a hard time swallowing, or their saliva isn't working well. Maybe they're having a problem producing a lot of saliva, because our normal saliva contains lysozyme and other things that should keep the yeast at bay. But when you have issues with swallowing, or you're not eating very well, and you're not using your saliva to the full benefit, you may develop situations like this. And so medications can have this effect and other things, and especially if you're immunocompromised, have HIV, or other things may cause these types of infections. Now, a lot of women can attest for the vulvovaginal yeast infection. And again, this is a painful inflammatory condition of the female genital region that causes ulceration and discharge. And again, a lot of women have had a yeast infection, and it's brought on a lot of times by either UTIs. Changes in the pH of the vagina sometimes can affect this. Menstruation can affect these things. And so it's not completely uncommon. And so typically we see it though as, again, things that aren't right with the body. And so there's immune compromise, and then these things develop. And so typically, if you're healthy and active in that, you shouldn't be developing yeast infections, but it's not uncommon, and the doctor, your gynecologist, might have recommendations, so and that stuff for preventing yeast infections. But again, airflow and everything else is very important. Hygiene is also another important thing as well. Okay, and then the last one is cutaneous candidiasis, and again, this is another one that occurs chronically in moist areas of the skin. Burn patients see this, and so again, opportunity where you have moist, dark areas, burns, other things like that are associated. And it's, again, immune compromised wounds in the skin. That's where you're going to see these different types of infections. But by far, probably the two most common are going to be thrush in the throat, and then the vulvovaginal yeast infection that you see. Okay, now diagnosis, again, presumptive diagnosis if budding yeast cells and pseudohyphae are found, and you can see germ tubes, and so these are the epithelial cells. So what they'll do is take a scraping and look for the yeast budding and making hyphae. So you can see the hyphae are these long strands kind of giving the furry nature, and then the buds are these yeasts that kind of form these buds and grow new yeast. Again, growth on selective media differentiates Candidia species, so you can figure out what it is. Topical antifungal superinfections, amphotericin B and fluconazole. Fluconazole is for systemic infections, but typically, again, those topical infections, amphotericin B and azoles, the azoles and that nystatin a lot of times. So if you look at yeast infections and yeast infection creams, it's going to be the same, whether depending on what over-the-counter medication you buy. Okay. Again, some have higher concentrations of certain ones than the others, but again, all very typical of what we see. Okay, now another one is a Cryptococcus pneumocystis, and it causes Cryptococcus. And again, this is not Cryptosporidium. That's going to be something we're going to be talking about in the next chapter, chapter 23. This is actually a fungus. Cryptosporidium is a eukaryotic pathogen that's found in water. These guys are found in soil and in pigeon roost, and again, it's a common infection in AIDS patients, cancer, and diabetes patients, where again, circulation is weakened, immune system isn't working as well, and so you see this again. Infection in the lungs leads to a cough, fever, and lung nodules that form. Disseminations to the meninges and the brain can cause severe neurological disturbances and death if not treated. And so Cryptococcus is one of those things that's rare, but when you have a weakened immune system, you're more at risk. And you can see, again, this one is superficial around the mouth and those areas, pretty nasty disease. And typically we see it in the lungs and very systemic a lot of times as well. Okay. Again, negative stain demonstrating the encapsulated budding yeast, biochemical tests, serological testing, and again, systemic infection requires amphotericin B and fluconazole. Okay, and so I can't say that one. I don't know why I can't say it, but fluconazole. We'll try that, fluconazole. Okay, and so again, those are what the different treatments are. All right, Pneumocystis carnae, or this GeroVC, is the newest one and the latest one that we see a lot in AIDS patients. Again, I think it's the third or fourth leading cause of death in AIDS patients, and it's due to a fungal infection in the lungs. And so again, it's a small unicellular fungus that causes pneumonia. It's the most prominent opportunistic infection in AIDS patients. So I guess it's number one now. So it used to be number 3 or number 4, but now it must be one of the highest ones on there and most persistent. And again, breathing in the spores gets into the lung, and with a weakened immune system, these can grow very well. This pneumonia forms secretions in the lungs that are blocked breathing and can be rapidly fatal if not controlled with medication. And again, pentamidine and trimoxazole is the 2 drugs of choice. And again, can't pronounce those things, but you can see them on the list and that stuff. Here are the spores and the yeast cells growing inside the lung tissue, and that you can kind of see how these things grow. And again, this is becoming more and more common, especially in HIV and AIDS patients that have this disease. Okay. Another one is Aspergillosis, which is the disease of the genus Aspergillus. It's a very common airborne soil fungus. It's typically found in the soil. Again, causes a lot of molds and mildews in there. A lot of molds and mildews that grow in our bathrooms are actually Aspergillus. And so again, there are about 600 species and about 8 are involved in human disease. And this fumigatus is the most common and against a serious opportunistic threat to AIDS, leukemia, and transplant patients. So again, breathing it in the air and getting it into the lungs causes the infection in this case. And again, this is very common, especially in moist, warm places in your house. You'll see these growing as mold and mildew, and that's what's causing those things. And again, it can cause allergies, but I'm not talking about allergies here yet. This is causing serious infections. So immune compromised, breathing these things in can cause some serious infections. Okay, another one that is causes the Aspergillus, and again, infection occurs in the lungs. The spores germinate in the lungs and form fungal balls and colonize the sinuses, ear canals, eyelids, and conjunctiva. Invasive aspergillosis can produce necrotic pneumonia, infection of the brain, heart, and other organs. And again, the two drugs, amphotericin B and nystatin, are the two main drugs in this case. And here you can see fungal infection around the eye, the sinuses. You can see the swelling of the sinuses. And again, these chronic fungal infections of the sinus and other parts of the body can be due to the aspergillosis. And again, immune compromise, especially transplant patients, AIDS patients, and people that have cancer and other things that our immune system has been weakened. Okay, the last one is kind of interesting because Zygomycota is typically your bread mold. And so Zygomycota are species of bread mold, and typically they're found in soil, water, organic debris, and food. And again, I think the most common Zygomycota that we think of is the black bread mold, and this includes Rhizopus, Abbacidia, and Mucor. And again, these are usually harmless air contaminants that invade the membranes of the nose, eye, and brain of people with diabetes, malnutrition, and leads to severe consequences. So again, you can see here's a pretty nasty infection, and this is due to an immune compromise. It's not due to the tattoo in this situation. It's probably due to some kind of immune compromise in this patient. Maybe they have diabetes or something else, and it's led to this skin infection due to the Zygomycota. The problem with this is so common, not in the sense that that it's so common that you see the disease, but the Zygomycota is everywhere. The spores are everywhere. And if you leave bread out for a while, it gets moldy. And the reason for that is because there's a lot of these Zygomycota just floating in the air. And so if you're immune compromised, this can cause a serious problem. And so that's why it can be scary, because it's everywhere. It's found everywhere. And it's all you need to do is breathe it in and just be immune weakened enough to get this disease. Okay, some other miscellaneous opportunists, again, can be implicated with infections when the immune system or defenses are severely compromised. Included the Geotracheum candidium, which is geotrichinosis, a mold found in soil, dairy products, primarily involved in secondary lung infections, and Fusarium species of the soil. Occasionally affects the eyes, toenails, and burned skin, and these are, again, pictures of the two. Again, causing opportunistic infections, breaking down mechanical barriers. Again, immune system dysfunction, diseases, other infections can lead to these types of diseases. Okay. Now, the last thing I'm going to talk about are allergies, because a lot of people do have these allergies and know when these come out, especially when we get into the summertime. So if you have summertime allergies and they're not due to grass or pollen, it's probably due to the mold that's in the air. And so when we get warm, moist, humid days, the best thing you can do is get into air conditioning, where these things, you lower the amount of moisture in the air, and these things make you feel better. But fungal spores are very common sources of atopic allergies. They can get people very sick. And so when I talked about the mold and mildew growing in your house, people can get very sick and have flu-like symptoms associated with the fungus. And that is due to breathing in these spores and then having an immune response that produces flu-like symptoms. Seasonal allergies and asthma can be related to this. So farmer's lung, tea picker's lung, and bark stripper's disease are all very common types of allergies associated with fungus. Again, fungal toxins lead to mycotoxicities, which usually are caused by ingesting and inhaling fungal toxins, and the alfalfa toxin is a toxin that is carcinogenic, grains, corn, and peanuts, lethal to poultry and livestock, so this can affect. But I do want to bring up one story about that. So if you've heard about the stories of the witches of Salem, and so you think that these people were possessed by the devil or by witches, and so they were burned at the stake. It was actually caused by a mold and mildew. And so what happened was these mold and mildew actually got into the rye and the wheat of these places. And again, they store rye and wheat over the winter, and people would eat these things and would basically hallucinate due to the toxins produced by the fungus. And so they didn't get all the fungus out of there. They get the toxin by eating the wheat or the rye, and then they become hallucinating and think they're seeing witches or being witches. And so when that happened, that's why they got burned at the stake. And so that was the reason why they got, it wasn't the devil was possessing him, but it was due to these mycotoxoses that they were getting from the toxins produced by the fungus in the vegetation that they were eating in these places. Okay. Obviously we learn now, but in the past, you can always explain things with science eventually, you know, if you figure it out. And then the Botrytis cardium is a sick building syndrome, severe hematology and neurological damage. And again, this is due to where people are, again, breathing in the spores, the mold, and the mildew, and they constantly get sick. And there are people that when they walk into a building right away, they would get sick, and again and again and again and again, and constantly get sick over and over again. And really, in these situations, there's not much you can do. People have filed lawsuits against that, saying the building's making me sick. I've got the flu type of thing. I can't come to work. I can't work in this building because every time I walk into the building, I get sick. And we do know that there are species of fungus out there that will do this, cause these allergy-like symptoms, and get people really, really sick. In those situations, basically the building is condemned and they have to either rip it all down and get rid of the mold, or just demolish the building and build it back up again. And so, again, the way the houses are built nowadays, there's more paper, more tight air spaces, and now the houses can't breathe as well, and so you get a lot more moisture trapped. You get a lot more mold and other things and growing on that wonderful drywall that we have instead of plaster. These things can grow and get people really sick. Again, drop ceilings, that material's all paper. You get moisture up there. A lot of times you see that. You'll see mold rings growing in there. That's another place that these things grow. And so anytime you have those situations, you got to eliminate the moisture and then kill the mold. And again, killing mold using hydrogen peroxide, bleach, and other things. There are certain solutions out there that you can find, like at Home Depot and other things, that work very well and can treat it. Now, if the mold problem is really bad and you got lots of mold and you open up a wall and you see that it's all black due to mold, that's when you need to call in someone and actually get that done. So that's one of those things that can get really your family sick, especially young kids, and lead to development of asthma and other respiratory conditions that can occur. So if you're living with mold, you want to get rid of it early on, treat it and get rid of it. So take care of it and clean it up. All right, so again, which of the following is the causative agent for oral thrush? Is it Geotrichum candidum, Cryptococcus pneumoformans, Candida albicans, or Tinea curris? Which is the one that causes oral thrush? And again, that's an opportunistic yeast infection. So which one is that? If you said Candida albicans, you are correct. So Candida is the wonderful yeast infection. And again, thrush and the vulvovaginal yeast infections are the two most common type. It can also cause cutaneous yeast infections as well. So you see that sometimes in the skin, the hair, and the eyes and that stuff of people as well. Okay? So we've come to the end of the chapter. Hopefully you got some interesting information out of there. Again, we divide these up based on true pathogens versus opportunists. And again, when we look at fungal disease, it can be caused by both true pathogens, getting healthy people, as well as immunocompromised, and the opportunistic pathogens. And so we talked about the two types. The true pathogens are the ones typically we breathe in by spores, upsetting the soil and that stuff and breathing those spores in. And again, it can affect healthy people as well as immunocompromised people. Healthy people tend to get over the disease, can produce flu-like symptoms, and eventually get over the disease. Immunocompromised have a lot more issues, and again, that's because of the weakened immune system. The opportunistic pathogens are the ones that, again, affect people that are typically immune compromised. Healthy people are not going to be affected by this. And again, you're probably thinking, well, I've had a yeast infection before. Was I immune compromised? Well, there was probably something that happened to you. Either you had a secondary infection or a primary infection or some other type of infection going on, maybe UTI or something else that led to that, and that is immune compromise. So again, when you have other infections going on, your body has to worry about that and not looking at other things and may cause infections in other spots. And so that's where you might see those things. Again, fungal spores infect the respiratory and layers of skin to begin the infection. So that's the primary infections, either the lungs, and again, the ciliary movement, helping get things out is very important. And again, getting in on the skin. Anytime abrasions, cuts, or wounds on the skin can lead to fungal infections as well. And again, the big thing about fungus is that they go from the hairy, hyphae-looking nodules that are transmitted by spores and that when the temperature is low to a yeast form once they get into the thing that looks more like bacteria, the smooth growing on the plates and those things. And again, they can invade and maintain in the tissues. Okay, the last thing is, again, the true pathogens that infect healthy people. Again, we talked a little bit about histoplasmosis, the Coccidioidomycosis, and then also the, what was the other one? I can't think of the other one, the Blastomycosis. And those things are typically airborne, breathe those in, get into lung infections, disruption of the soil. And again, most people would get over those infections. You might get some flu-like symptoms associated with it. Unless you're immune compromised, then it can get more systemic. Most common true pathogen most people get are skin infections, all the wonderful ringworm infections. So again, ringworm growing under the skin, causing those things to form and causing those types of infections. Again, athlete's foot, fungal nail infections, and then the common ringworm of the smooth skin. And then we talked a little bit about the primary opportunistic pathogens, immunocompromised. And again, the yeast infections, the Candida, which is very common for those with, again, immune compromised, the oral thrush or the vulvovaginal yeast infection. And then pneumocystis, a very common AIDS, HIV infection that we're seeing in a lot of patients that are immunocompromised. And then finally, similar treatments for all fungal infections. Again, a lot of the ones were amphotericin B and nystatin or one of the azoles. And again, the reason for that, very few targets, very similar to us, eukaryotic pathogens. And so they're eukaryotic, they're going to be a lot like us. So what are different? Cell walls and cell membranes are slightly different in the fungus. And so that's why a lot of the drugs are the same thing. Okay, so we made it to the end of the lecture. If you have any questions, please feel free to ask me. Send me an email, send me a comment type of thing. Stop by my office hours. I'm glad to answer them for you. If you have any questions about this, again, we're on our last unit. Next lecture is going to be looking at the parasites, the eukaryotic parasites that affect us, and that I think it's a real interesting chapter. We'll talk about the worms and all that fun stuff, and looking forward to that one. Again, if you have any questions, please let me know. Thanks for watching, and I'll see you next time.